I'm a doctor. I work in a hospital. This is a true story from my. It was a Monday morning, just like any other. We had a full census, meaning all of our beds were full. We had patients lined up in the hallway waiting for a bed to become available. And we were just kind of running with the flow of things. One of the patients we had admitted was in for a routine operation. Nothing major, a common surgery that we see all the time. So I was working with the team, getting the patient prepped and ready for their surgery. As the anesthesiologist was starting the surgery, I noticed that they had a sudden, flash of light in the oar. And when my eyes cleared, the patient was gone. The monitors that were hooked up to the patient flatlined. The table was empty. The surgeons were looking around. Nobody said a word. It was literally like the patient vanished into thin air. The last thing we saw on the monitors was the patient's abdomen, with the surgical site marked and prepped. And then when we looked over, there was no body. The patient's arms were still in the restraints. The only thing that was on the table was an empty abdominal drape. We immediately hit the code, which means we call a bunch of people really fast. And we started searching everywhere. We looked under the table. We looked in the closet. We looked in between the curtains. We even looked in the ceiling above the operating room. But we couldn't find the patient anywhere. It was just a static image the whole time. It was like the cameras were blinded during this time as well. It's like the patient is still in the hospital, but nobody knows where. I hope that wherever this patient is, they're okay. I really do. But the scariest part about this story is that it actually happened.